The United States continues to make good progress against the COVID-19 pandemic, as well as the vaccination program. Let's bring in Dr. Jay Schnitzer. He's the Vice President, Chief Medical Officer, and Chief Technology Officer at MITRE Corporation. It's good to have you back in the program. What is the thing we should think about most when we are able to report that new U.S. cases of COVID-19 have now fallen below 30,000? Is this something we can say is permanent, the trajectory downward?
We hope so. So thank you for having me back. It's great to be with you. And yes, this is good news indeed. We've known for some time that the vaccines were the way out of the pandemic. And the good news is they're working. And the more Americans are vaccinated, the better the results. And we're seeing that in real time play out as the number of hospitalizations goes down, the number of new cases per day goes down, and the number of deaths go down. And this is all good news. We're not out of the woods yet. We're not done. We need to get more people vaccinated, but the vaccines are working.
Doctor, we also have the story today that the EU is opening its borders to travelers who are vaccinated. If we see travelers go from the U.S. over to Europe, then come back, should there be any concern there just about the variants or anything that can be brought back here to the U.S.?
There's always concern about the variants, and they're always going to be the wild card. However, if U.S. travelers are fully vaccinated prior to going to the EU and then come back and have minimal contacts with anybody who's infected over there, we should be fine. There's no guarantee. The risks are always there, but they should be minimal for fully vaccinated individuals. And the vaccines we've seen are very effective against the mutants.
The International Air Transport Association has a kind of vaccine passport program. It's optional right now. New York State has the Excelsior program, My COVID card or whatever is in this thing. Is there going to be some kind of standard certification or notification procedure so that when I go somewhere, I can just show this and I'm good to go that I've been vaccinated?
There is an initiative from the private sector, which we are part of, which we MITRE are part of, to do just that. And what that will be is a credential that you can download either onto your smartphone or as a hard copy with a QR code and display and give to anybody who asks you for proof of vaccination if you wish to share it. That will be a legitimate credential that can be used. And we'll see the first examples of these coming out from the manufacturers in the coming weeks.
Doctor, we also got that figure, at least 600,000 kids ages between 12 and 15 have already gotten the first dose of the vaccine. I'm curious just how you're looking at that number. Is that better than you were expecting to see?
It's about what I was expecting to see. We know that parents are going to be cautious about their children. That's to be expected. That's normal. We all should be. These vaccines are safe. The more that get vaccinated, the better. But people are going to take their time thinking about it carefully, reviewing all the evidence. They should do that. On balance, when they do that, I think overwhelmingly they're going to come to the conclusion that the risk of the vaccine is far less than the risk of COVID. And therefore, it makes perfect sense to have children 12 years of age and up vaccinated as soon as is possible.
Help bring us up to speed on where we stand if you're vaccinated. If you do somehow have one of those breakthrough infections and you test positive for COVID without symptoms, will you spread the disease if you've been vaccinated, or are you not going to be a spreader?
We don't have perfect data on that question yet, but the early data suggests that it is unlikely that you will spread, which is good news. So even if you get a breakthrough infection, you are likely not going to be as contagious as if you had not been vaccinated. This is good news for everybody, not just the person who got the infection. Not only will you not have serious illness that will not put you in the hospital and will not kill you, you are less likely to spread it as well. So good news is, even if you get a breakthrough infection, bad things are unlikely to happen as a result. That's great news.
Every time we have these discussions, what I keep hearing is the bottom line is get vaccinated. Dr. Jay Schnitzer, you wanted to make a final comment?
I was just going to say, please, please get vaccinated as soon as you can. The more of us who are vaccinated, the better off each of us is, your families, your friends, your colleagues, and the country. Please, please get vaccinated.
Patriotic duty. Dr. Jay Schnitzer, Vice President, Chief Medical Officer, and Chief Technology Officer at MITRE Corporation. Thank you so much for joining us.